So Dr. Nick Bontempo is joining us now. Now your specialties are hands and wrists, but you do all orthopedic surgery, right? You could do an elbow if you had to.
I do elbow, actually.
Oh,
he
okay.
does
So you do. Do you do Tommy John?
Yeah, I do.
Oh, okay.
I do from the elbow down.
All right, so let's talk about Giancarlo Stanton.
Okay.
He starts swinging a different bat that loaded the weight from, the end of the bat towards the middle.
Torpedo bat.
The torpedo bats.
Right,
and it's kind of messed up his elbows. Why would that? Well, there's no give in the bat. So when he's swinging it, unlike a golf club or anything, other bats, there's a little bit of whip to it. Why would that put so much pressure on his elbows that he'd have to go on the IL? What kind of damage is that doing?
So I'm not familiar with the difference of the types of bats. So you could tell me more about that.
So the torpedo bat, you're taking the weight of the end of the bat and moving it over. And so it goes to thick and then back to small. So
Okay.
it looks like a torpedo.
But
there's no give
so
in
it's
the
got-
middle of the bat because you centered the weight.
Gotcha. So less give than a traditional bat.
Yes.
Gotcha. So when you're hitting a ball, like the energy's got to go somewhere, right? And if there's no give in the bat, you're going to transfer that energy to your arm.
And it's going into your elbows.
It's kind of stress on the inner part and stress that ligament, the classic Tommy John ligament. That's where you're going to see all those issues.
Okay, so getting into that. So one of my players got injured lifting weights for football, needed Tommy John surgery. I'd never heard this. They took the ligament out of the same arm.
Yeah.
They took the ligament out of his right arm and put it in his right elbow. When did they start doing that?
That's how the surgery's been done traditionally.
Really?
So it's
I
not.
thought they took it out of your left arm. They didn't. They took it out of your right arm.
So they usually use a ligament called your palmaris longus, and not everyone has it. Some patients only have it on one side and not the other.
You got to be kidding
So
me.
there might have been a reason why in that
What?
particular, in your athlete, that they took it from the same side.
We learn things every day on this show.
Really?
All right, so R.A. Dickey was born without an ulnar collateral ligament. Explain that. How does that happen?
Just developmental things that can happen as you're being born and whatnot. But for a lot of patients, they can function well with like an insufficient ligament. But when you're talking about athletes, it's a totally different story. It also depends on what type of athlete you are, like what you're doing.
So what does it do to your arm now that you took that out? Or let's just say you take it out of the hamstring. God didn't intend you to take it out of the hamstring. Now what does it do to you?
Yeah, so with the palmaris longus in particular really does not serve a function. It doesn't cross the wrist joint. It doesn't allow you to flex your wrist or do anything. And that's why about 30% of patients don't even have one at all.
So it's just like a spare tire, just hanging out in your wrist.
If that particular tendon absolutely is. So if you think about almost like your appendix, you can live without your appendix, same idea. So this particular tendon you can live without. And in fact, a lot of patients don't even have it.
Oh my
Absolutely
gosh.
crazy.
I did not know any
so
of this.
was Dr. Job the first one to figure that out?
Yeah, that's what I'm
That
wondering. Who found that
who's the
out?
first doctor to be like, you know what, I'm going to take this part of the human body and put it in this broken part of the human body because you don't need it. How do you even figure that out?
So just from anatomic dissections, you kind of look at where things start, where they end, what joints it cross, what it attaches to, and you figure out what the function is. That's how, and based on anatomy from hundreds of years ago, that's where they figured it out. And that tendon in particular, they dissected, thousands of cadavers and figured out what the function of each of the tendons are. And what you can sacrifice, what you can't sacrifice.
Have you been following Shohei Ohtani? He went back, he pitched, finally, was it 8 months after Tommy John surgery?
Yes.
He's been
His second Tommy John surgery in 5 years.
That's crazy.
How much?
That's crazy.
Explain
That's
that.
crazy. I mean, he's a high-level athlete, right? So, but typically, once you have that done, like one time, the surgery, you should be good to go. So the fact that he had it done twice definitely raises my concern that he could potentially re-injure it.
All right, so I don't know particular if it snapped or could the screws. You're the doctor. You can explain this much better. What do you think could have failed?
So it could have been the tendon that they put in there. So I'm not sure how they repaired it. So you were talking earlier about taking your own tendon. Sometimes they'll use tendon from a cadaver.
He had that done in his shoulder.
Right.
Check it out.
Yeah.
Pretty cool. Get that
Sweet
on
scar.
camera.
Probably get lots of chicks with that one.
A lot.
Lots, right?
It's the first conversation we have usually.
All right. Again, so
you can use
when you harvest that from the cadaver, how long has that cadaver been dead?
So
And why is it still viable?
that's something that they usually harvest, like, from organ donors and stuff like that. And then there's companies that process the tissue, so you don't not at risk for getting infection or disease transmission or things like that. So using cadaveric grafts are very, very common in orthopedic surgery. And then also you can use your own depending on what you're doing, right? But yeah, the cadaveric stuff is very popular. Then there's also ways to augment the repairs. Like for Tommy John, there's ways to augment it with this super strong suture that try to help reinforce the tendon that you're putting in there.
Is that the internal brace?
Yeah.
Okay.
Yeah. Yep.
How much more of those are you
This is
doing?
fascinating.
These internal braces, because we're seeing it a lot more in baseball.
Well, Trevor's story had
Yeah.
it.
Trevor
Yeah. I mean,
Story.
and I forget who was it. Drew Brees, or who was the football player?
Yeah.
Might have been Drew
Drew
I think it was Drew
Yeah.
Brees had his thumb done.
Yeah.
So I haven't done any for the elbow. I've done one for the elbow, but I've done a bunch for the thumb, and it's really it's amazing how well it works.
What is it made out of?
So it's a braided suture that's super, super strong.
But when you say suture, what's the suture?
Yeah.
What's that made out of?
Some type of like polyester material, and it's braided. It's like woven, and it's a super strong material.
Doesn't your body say, I don't want this?
It do-
Especially like the internal brace?
No, for that particular material, the body actually tolerates it well. For most patients, I mean, you'll get a small subset who might not tolerate it, but for 99% of patients, it won't be an issue.
We're talking to Dr. Nicholas Bontempo from Orthopedics, the Bone and Joint Institute at Hartford Healthcare. We love this kind of stuff, if you can't tell.
No, I'm happy to talk about it.
Yeah, but we talk about these injuries all the time. Like even like an Achilles tear.
Yeah.
Why is that such an awful injury for an athlete?
So you can imagine, running. I mean, any sport you're doing, maybe not golf necessarily, but any other sport you're running, there's a tremendous amount of pull of that tendon on the back of your heel as you're running to make your foot go downward. So to get that to heal, it takes a lot, because you have to prepare the bone. You got to repair the tendon to the bone, but then after that you got to give the body time to heal it, and that's where the recovery comes into play. Same thing. We're doing rotator cuff repairs. I do a lot of distal biceps tendon repairs, where the tendon pulls off the bone. You got to reattach it, and I tell patients all the time, like, for me, all I'm doing is fixing it. I can put the tendon back where it came off of, but your body's got to heal it. And right now, there's no way to speed that up. In general, it takes about 12 weeks, roughly, for it to be fully healed before you can really start stressing it again.
All right, so 12 weeks for like a Tommy John just to heal.
Mm-hmm.
And then what happens?
So the Tommy John's a little different, because in that case, what I was talking about with Achilles or rotator cuff or distal biceps, you're repairing the patient's torn tendon back down to their bone. When you're doing a Tommy John surgery or reconstruction, you're taking a tendon from elsewhere, whether it's their own or a cadaver, and then you're just wrapping it inside the bone to help reconstruct the ligament that's torn. So that, and you're expecting kind of everything kind of scarring again. But it doesn't necessarily need to heal per se the way when you're repairing your own tendon back down to bone. But you still need to give the body time to let everything calm down before you can start stressing it again.
Here's the dumb question of the day, and this cadaver tissue stuff. Like,
Yeah.
I'm just interested in
Where is it?
Yeah,
Where are we keeping it?
Right, like, so it's like, oh, okay, I need another Achilles, need some shoulder rotator cuff stuff. You go to a fridge somewhere, you just open up a fridge, like, I got a couple of those here.
Yes, you do.
Shut
Oh my
up!
God.
So there's literally a freezer that they keep human tissue in, whether it's bone or tendon or ligaments, whatever it is that you need. And when you're doing a surgery, you call for it. And sometimes you have options. You can pick a big one, a small one, whatever you want.
Oh my God.
And then you got to thaw it out, and then you use it. But yes, exactly what you described.
Do we know where they come from? Because I'm always thinking of Frankenstein.
What
Like,
are you
maybe
gonna do?
I got a
You're gonna
murderer's.
ask what their name is?
Well, maybe I got a murderer's
You're
shoulder.
so weird. Yes,
and it's got a mind of
where
its own.
You're jumping the shark here.
No, I don't think so.
So no, we
He's
don't.
not. He doesn't care.
Yeah.
He's taking it and he's
I
fixing
care
it.
as the patient.
So as the patient, we don't. Patient doesn't know, and even as the doctor, we don't know. We know it's coming from a tissue bank. We know it's been processed. We know it's safe to use, but we don't know like the actual true origins of like race, ethnicity, age, any of that kind of stuff. We don't know any of that.
Oh, really?
That is awesome. That is so awesome.
So yeah,
No, you have the greatest job.
it's cool. I think it's cool.
You play with
I
so
like
many
I like
stuff.
fixing broken stuff.
All right,
That's all.
so
it comes down
what are
to.
some of the newest innovations in your world?
Well, one of the that you alluded to earlier is the internal brace. It's been huge, and the reason for that is because athletes in particular, they want to get back to play as soon as possible. So if you just repair the regular ligament down to the bone, you got to lock them up in a cast. Then they're going to get super stiff. Usually mobilize them for like 6 weeks or so for the thumb. With the internal brace, you can start moving them right away. I mean, I think Drew Brees was back playing in 3 weeks. It's pretty quick.
That's crazy.
Right? So, so those types of things are really nice because it lets all the athletes get back to play. I mean, I work with a couple of the colleges nearby, and I love taking care of those athletes because they are super motivated. Unlike other patients, but the athletes in particular, they just want to play. That's their life.
The one thing about Hartford Healthcare Bone and Joint Institute we love is you guys get baselines from some of these athletes. Like some of the universities, I know Trinity is a big partner with you guys.
That's where I work,
That is so beneficial for those student athletes to come in as incoming freshmen, get a baseline test, and then when you get them after an injury, God forbid, you know where they came from. And how beneficial is that for your team?
It's huge. I mean, it's great for the athletes to kind of get that baseline assessment. The therapists really get to know them as a person, as an athlete, kind of where they stand. And then when there is an injury, they know they have a goal to get them back to. Like they know where they're supposed to be, so they know what they're trying to work towards.
What about golf? We're out here at TPC River Highlands.
Talk about hands here.
I always think of hitting those roots, man, as if I come down on the roots, all my left side, because I'm a right-handed player, all my left side will be stinging. What's up with that? What am I doing there?
Yeah, so what I see a lot, especially as the weather gets nice here in New England, springtime, guys start swinging their clubs, a lot of wrist injuries, just like you said, hitting roots. So, hitting divots, whatever the case may be, think about how fast you're trying to swing the club through to hit the ball, and something stops you hard, fast. And back to the energy, it's got to go somewhere.
Got to go somewhere. Goes right up your arm.
Exactly. So if
stop hitting roots,
the club.
Tough, man. I'm always in the trees. Yeah. You know that.
The club stops at the root, and the energy's got to go somewhere. And usually it goes through the wrist. There's going to be some stress on the elbow, but what I see more often are wrist injuries. A lot of pain on the side of the wrist where like the small finger is.
Right.
Lots of issues there.
What is the most common hand injury that you see? Is it in the fingers? Is it in the palm area? What is the most and what is the most difficult part of the hand to fix?
The most common thing we're going to see in the hand are fractures, whether it's in the fingers themselves or in the hand. But with sports, you're going to see fractures, depending on the pattern of the fracture determines how you fix it. And, talking about new innovations, like I had 2 or 3 Trinity athletes this year, 2 basketball players had multiple fractures of the metacarpals in their hand. And, traditionally we would just put pins in or wires to help hold it. But while those pins are in, you can't do anything. If you put a plate and screws in, it's okay, but it's still not super strong. There's this new technology where we can actually put a screw inside the bone. Acts like rebar, almost like an internal strut. And you can get them moving right away. So kind of like to the Drew Brees things, I had some of these players back in a couple weeks.
And they won a national title, men's basketball.
And they won a national title.
Did you get a ring? Did you get
no ring?
Oh, man.
I got a photograph.
There you go. All right.
No
there
ring.
You go.
But yeah, and actually one of the players, had the pain on the side of the wrist that I was talking about earlier, basketball player, but same type of injury. And I gave him an injection like a week before they had their finals, and he was the star player for the game.
Dude, if it wasn't for Nick Bontempo, we ain't celebrating a natty over there at Trinity. You got to think about that Galbraith over there.
Right, so David Ortiz in his career, there's a sheath or something that goes right through here where your ligaments and nerves
tendons,
go through, right?
Yeah.
And he hurt that, but Teixeira did the same thing. Where these guys injured that really bad. How common is that for swinging golf clubs, tennis rackets?
Not too common. I'm not sure exactly what his injury was.
But isn't there something that covers your internal stuff inside the wrist?
There is, but on a wrist on that side, there's actually 6 different compartments, each one is it's compartmentalized. So depending on which one was injured, but yeah.
So some kind of compartmental syndrome, right?
Correct. Yeah.
That's what they say. Because that's like Deion. I played with Deion Sanders.
Yep.
He had it in his ankle.
Yep.
And then it led to his blood clots and stuff, and they had to cut his toes off.
That's a little different. So compartment syndrome is different.
Is that different?
Yeah, that's different. In the wrist though, there's the compartments are different. It's just an area where the tendons run through. You're not going to get a compartment syndrome in there. So
On top of my stupid questions, the other thing I love asking bone and joint people is the old wives' tale questions. All right, I broke this hand, man. These, what are we, metacarpals?
Yep.
I broke these metacarpals on the wall baseball trying to rob a home run. Nobody told me where the wall was. Rest is history. But I've always been told it's going to be stronger than it was before you broke it. Is that true?
It's not true. It's it will be as strong as it was. So, like, the nice thing about bone is it's one of the only tissues in the body that heals with itself. So a lot of other tissues, even like if you cut your skin, like you're gonna get scar tissue there. Bone actually heals with bone. So that's the nice thing is so when the bone heals, it's as strong as it was beforehand. So it's reassuring to a lot of parents when they come in with young kids who break their bones, like, Doc's more susceptible to re-breaking his bone, things like that. And the answer is no. Like you can re-break it again, but you're not more prone to break it because it's as strong as it was beforehand. It's not stronger.
The injuries that I had in college football, just my teammates, 4 hands, here they are, boxing on an off night with the boys, and that boxer fracture coming down.
Yeah.
Like they don't know how to punch, or I'm so mad.
How do you properly punch?
I'm so mad at myself, I'm going to punch the mirror. I had a quarterback do that, broke his hand. Throwing hand, what are you doing, dummy? So these dummies, this is, like Dibs, I don't think people know how to punch anymore.
No, that's so, they call it a boxer's fracture, but it's kind of a misnomer because true boxers are not going to hit with their small finger. And that's where a boxer right. So true boxers are going to hit with their index and middle finger, dead on, direct punch. That's where you're going to get boxer's fracture. And if you ever take care of a real boxer, that's where they're going to have arthritis, is right in the index and middle finger, right in those big knuckles. But the so-called boxer's fracture is for those like brawlers, if you will, who are not real boxers. They do the kind of the side swing. They're going to come through. They're going to hit their small finger knuckle. They're not going to hit direct head on. They're going to hit the small finger, and that's where it breaks. And it's called a boxer's fracture. But real boxers don't get that.
I know you have 4 kids. Are you like extra cautious because you're a doctor? Like when they're riding bikes and stuff like that, because you probably see some broken wrists and broken hands with bikes and stuff.
This was up for discussion with my wife when we got a trampoline.
Oh my God!
I did not want to get a trampoline at the house.
Dad on this one.
Those are so dangerous.
So I can't tell you how many times when I was a resident at the children's hospital, literally every night.
So your son's saying something right now. What's he saying? You didn't want it?
I'm not sure. I didn't want the trampoline. So, but when I was on call, at the children's hospital, literally every night I'd be on call. Sure enough, after dinner, the kids ate dinner. They go out and play on a trampoline. They fall and break their wrist. Then they call me to come in to set their wrist, but because they just ate, they can't get sedation for like 6 hours. So like they call me at 6 p.m. I can't go until midnight to take care of them. And it's like clockwork. Every time the weather's nice, 6 o'clock, 7 o'clock, I get a page. You got to go into the hospital.
Wow.
And you got to wait. So I mean that's one thing. But my wife won that battle, and we got the trampoline. But to your other point, the other thing I hate are monkey bars. So I'm away last week with a couple friends, and I get a call from my wife. Our daughter fell off the monkey bars, hurt her wrist. So I'm thinking, no big deal. She didn't do anything. She's fine. I come home. I come off the plane, get to my house. She runs up to me, Daddy, check my wrist out. And she's a tough girl, and she's like pretty tender, right over her wrist. So I take her to my office, take X-rays, and the X-rays actually look normal, but in kids, they can get a fracture through the growth plate that you can't see on an X-ray. So it's more of a clinical diagnosis. And I tried putting her in a brace, and she did okay with it, but she was still pretty sore. So after the weekend was over, I took her back, and we got her in a cast, so she's fine.
Nick Bontempo telling the kids and the parents, watch out for the monkey bars,
trampoline,
and if you're punching somebody in the face, use the index finger or the middle finger knuckle.
You got it.
You guys are taking in the tournament this week. Are you here more than just today, or is today the day?
I'm going to probably be coming back on Saturday as well.
Oh, so you're going to be in the suite over there between 15 and 16?
Yeah.
Do you have a fave golfer? We're making picks here today before the Thursday round gets started. Who you like?
Probably go with Spieth.
Ooh, we've heard some Spieth out here. He was out here real early on Monday.
Okay, nice. I heard Tiger Woods was here yesterday.
Tiger Woods
That was because they got the head of the PGA is retiring, and they brought in a guy from the NFL.
Yeah, don't blink. You may have missed that.
Arthur Blank, the NFL owner from the Falcons, he was here too.
Nice.
Oh, yeah.
Yeah, I heard he was just in and out, like not staying.
Yeah. Okay, so Jordan Spieth. Why Jordan Spieth?
I don't know.
Were you here in 2017 when he chipped in from the sand?
I was here in 2017, yeah.
So is there
Yeah.
a soft spot, or did he sign an autograph for the kiddos?
No,
and then,
no autographs.
Oh,
I've
okay.
never met him. Never met him.
See?
So this is real deal. Okay,
Yeah.
let me write that down to make a play on it tonight. Bontempo told me.
Don't bet on me though. Forget
Nicholas,
it.
thank you so much for
Thank
coming
you.
on with us,
Thank you for
man.
having
That
me.
stuff is fascinating. Next time we have a bone and joint,
I wanna
which is
see
once
this
a month.
fridge.
No, we want to have you on again.
And I want to see this freezer of
He's
all the
not gonna
cadaver
show
stuff.
you.
What? Why not? If we wear masks
top
and gloves
secret
and stuff,
cadaver
and, like,
stuff.
we won't get breathe on it.
But it's like ordering. Like you're going to be taking someone in to fix their Achilles. Like, all right, call up the OR. Like, yeah, I need to have an Achilles ready at 3 p.m. Yeah, you order it, and so
awesome.
they
Do
have
you
it
listen
there.
to music when you're doing operations?
I do.
That's awesome.
What
do.
is what? Dr. Feelgood, Motley Crue.
I do love Dr. Feelgood. I do love Motley Crue.
Shut up!
There you
Like,
go.
I-
That's awesome.
I
Some of your patients wake up and go, man, all of a sudden I like Motley Crue.
I love listening to music. I'm a musician myself, so I love listening to
Nice.
music. I'm not a huge country fan, so whenever the nurses and whatnot ask me, I'm like anything but country. But other than that, we're blasting hardcore rap, heavy metal, rock and roll.
Some DMX.
Oh yeah,
There
Where
you
I'd
go.
like to get
Beastie
fixed up.
Boys.
Yeah,
I
Bontempo
don't know. I might
work
have
on
to
my
slip and
hands.
fall.
Yeah,
Work on me.
exactly. Sounds like fun.
awesome.
Nicholas, thank you so much, man.
Thank you. No, guys, thanks for having me so
All
much.
right, we'll be
Appreciate
right
it.
back with Sports Menu live at Travelers.